The content of this video is based on preclinical studies, including human breast cancer models, in vitro, in vivo. Preclinical evidence does not imply clinical efficacy. Microtubules are dynamic components of the cytoskeleton, which play important roles in many cellular processes, including mitosis. These polarized hollow tubes are formed by the polymerization of alpha-beta tubulin heterodimers and are crucial throughout the cell cycle, helping to organize cellular components and split them into two daughter cells during mitosis. These dynamic structures fluctuate between periods of growth and shortening in a process referred to as dynamic instability. Microtubule dynamic instability is crucial for mitotic spindle organization and function. Disruption of microtubule function results in mitotic blockage, leading to apoptosis, or programmed cell death. In cancer, cell cycle orchestration is disrupted, enabling cancer cells to grow and divide in an uncontrolled manner. Treatments which seek to alter microtubule dynamics may help to reduce cancer cell proliferation. Halaven, eribulin mesylate, injection is a microtubule inhibitor indicated for the treatment of certain patients with advanced liposarcoma or third-line metastatic breast cancer. Halaven exerts its effects by binding to specific sites on the growing plus ends of microtubules, inhibiting their growth and preventing normal mitotic spindle formation. Halaven also sequesters tubulin into non-productive aggregates. By binding with high affinity to microtubule ends, Halaven inhibits microtubule growth, prevents normal mitotic spindle formation, and as a result, induces irreversible mitotic blockage and triggers apoptosis. During tumor growth, insufficient blood flow creates an oxygen-deficient or hypoxic environment. This can induce the expression of factors which promote angiogenesis, the formation of new blood vessels from pre-existing blood vessels. This can lead to disorganized tumor vasculature, genetic instability, and additional genetic changes, which can favor cancer growth and promote migration and invasion of tumor cells. Regions of tumor hypoxia can bring on phenotypic changes, including epithelial to mesenchymal transition, or EMT. The mesenchymal phenotype correlates with increased migration and invasiveness of tumor cells. Hypoxia exists in tumors and is thought to be a driver of tumor progression. In addition to its tubulin-based antimitotic mechanism, Halaven has been shown in preclinical studies to have complex non-mitotic effects on tumor biology. Mouse xenograft models of human breast cancer have shown that Halaven can induce vascular remodeling, which increases vascular perfusion and permeability in tumor cores and reduces the hypoxic conditions associated with an abnormal tumor microenvironment. Additional non-mitotic effects of Halaven include changes in morphology and gene expression, promoting the epithelial phenotype. It has also been shown to decrease the migration and invasiveness of human breast cancer cells in vitro. In summary, microtubules are dynamic components of the cytoskeleton which are crucial for cell cycle orchestration, a process which is disrupted in cancer, enabling cancer cells to grow and divide uncontrollably. Halaven binds with high affinity to growing plus ends of microtubules, inhibiting their growth phase to cause irreversible mitotic blockage and cell death by apoptosis. Halaven also causes changes in morphology and gene expression, as well as decreased migration and invasiveness in vitro. Mouse xenograft models of human breast cancer have shown that Halaven can induce vascular remodeling, which increases vascular perfusion and permeability in tumor cores and reduces the hypoxic conditions associated with an abnormal tumor microenvironment. Please see important safety information presented in this video and visit www.halaven.com for full prescribing information. The following is important safety information about Halaven. Eribulin mesylate injection. Severe neutropenia occurred in 12% of patients. Febrile neutropenia occurred in 5% of patients with metastatic breast cancer and 0.9% of patients with liposarcoma or leiomyosarcoma. Monitor complete blood cell counts prior to each dose and increase the frequency of monitoring in patients who develop grade 3 or 4 cytopenias. Delay administration and reduce subsequent doses in patients who experience febrile neutropenia or grade 4 neutropenia lasting greater than 7 days. Grade 3 peripheral neuropathy occurred in 8% of patients with metastatic breast cancer and 3.1% of patients with liposarcoma and leiomyosarcoma. Patients should be monitored for signs of peripheral motor and sensory neuropathy. Withhold Halaven in patients who experience grade 3 or 4 peripheral neuropathy until resolution to grade 2 or less. Halaven can cause fetal harm when administered to a pregnant woman. Advise females of reproductive potential to use effective contraception during treatment with Halaven and for at least 2 weeks following the final dose. Advise males with female partners of reproductive potential to use effective contraception during treatment with Halaven and for 3.5 months following the final dose. Monitor for prolonged QT intervals in patients with congestive heart failure, bradyarrhythmias, drugs known to prolong the QT interval, and electrolyte abnormalities. Correct hypokalemia or hypomagnesemia prior to initiating Halaven and monitor these electrolytes periodically during therapy. Avoid in patients with congenital long QT syndrome. The most common adverse reactions in patients with metastatic breast cancer are neutropenia, anemia, asthenia, fatigue, alopecia, peripheral neuropathy, nausea, and constipation. Febrile neutropenia and neutropenia were the most common serious adverse reactions. The most common adverse reactions in patients with liposarcoma and leiomyosarcoma are fatigue, nausea, alopecia, constipation, peripheral neuropathy, abdominal pain, and pyrexia. Neutropenia and pyrexia were the most common serious adverse reactions. Because of the potential for serious adverse reactions, advise women not to breastfeed during treatment with Halaven and for 2 weeks after the final dose. A reduction in starting dose is recommended for patients with mild or moderate hepatic impairment and/or moderate or severe renal impairment.